morning, everyone. Hope you're still with me. I know in a few minutes we'll have our lunch, so please bear with me. My name is Doctolero, and I have been with TeleTech for 12 years now. And during those 12 years, I saw the revolution or the evolution of our healthcare program. And before I start, I would just like to thank Richard Mills and Rebecca. Thank you for inviting us today to this presentation. We're so honored to be lined up with distinguished guests and speakers, so thank you very much. Also, we would like to thank Healthway for including TeleTech in this forum. And it is something that we're really looking forward is to share the experience. So what have we discussed so far? Number one is that the health and safety occupancy inside our company or our workspace. Second is how can we become happy, right? And then the third one is why. Why is it important? I think the last one, Dr. Ara, thank you very much for sharing that, is how are we going to do it within our company, right? I'm here in front of you right now to tell you more about a story on personal experience. And that was me being an agent 12 years ago and seeing that evolution up until this point. So allow me to introduce myself first. I'm Doctolero, and part of my responsibilities overseeing the standard operating procedures for all of our sites in the Philippines, and also doing employee engagement. We had the employee engagement in the Philippines. I am married, a father of two, and a passionate motorhead during the weekends. And also, part of it, these are the foods that I want. Crispy pata. I also started smoking when I was 17 years old. I weighed about 230 pounds more just a year ago. And I spent too much money on some things that, probably is not that important. So you would see, basically I would say I was out of control during that time. And with the health and wellness program of TeleTech, it helped me be more educated on what I need to do. And my perspective changed and this is my why, when I had my two kids. I wanted to make sure that when they grow up, I would be able to provide for them, see them, and support them on whatever things that they wanted to do. And I guess this is an eye-opener for most of us who had life-changing events. When I'm sick, I always think, even if it's a flu, I always think it's the end of the world for me. So I try to, I feel really bad when I get sick. So the story that I have would be more of, before in 2005, I was just thankful to have a health card and not worry about anything in the hospital when I get sick. Now I'm thankful because we have a lot of health and wellness programs that, instead of being reactive to sickness, we are being proactive in managing health and wellness. So allow me to continue. Our health and wellness mission is to create a culture that encourages healthier lifestyle choices by providing mind, body, and financial activities and resources that will help our employees live well. In TeleTech, we have about 20,000 employees. We grew to 22,000 in 20 locations. So this is really an integral part of our culture. When you are affecting the lives of 20,000 employees plus their dependents, I think it's very important that this is something that we look at as employers. And we have to know the why first, or what are the things that triggers, and what are the things that we will be doing for health and wellness. Number one, we gathered survey. Second is we try to analyze what are the claims analysis from our HMO card. And as discussed before by Dr. Ara, is that annually we have an annual physical examination. Now all of these findings or all of these data are put together and make sure that we identify, what are really the things that we need to do in our company? Because you cannot just create one program and hope it sticks to our employees. We have to continue to stay relevant to whether Gen X, Gen Y, Millennials, or Generation O. And what we found out are this. The universal health risks are still continue to remain to become obesity, smoking, stress. By the way, when I put up the picture earlier for smoking cessation, I'm glad to tell you that after just 2 years ago, quit smoking because of the smoking cessation program. And going back, we identified the health and issues claims by our HMO coverage, which is hypertension, gastrointestinal issues, and asthma. So I believe this further solidifies the data that was provided earlier to us. Now we know what's causing and what are the triggers of these things. So we have to come up with a strategy. We discussed clinics earlier. We should have a good clinic management. We also discussed about benefits. It's nice that, sometimes it's hard to get participation. Maybe it's a culture thing or if it's not marketed properly. But as we were talking about earlier, we need to find that reason of why so that we can have all people join our wellness activities. And then, of course, we need to have the programs associated with it. If you look at the 5 key components, there are focus initiatives, core programs, wellness incentive, supplemental mind, body, and finance program, health and social awareness and education campaigns. These are the things that we saw that's relevant to the data that we got from our yearly performance examination, or APE, or annual performance examination. So these are the physical examination, I'm sorry. So these are the data still, annual physical examination, health risk, claims data, and on-site clinic utilization. So we know now where we started. Now the question is, what are you going to do about it? And before we act on it, we need to make sure that we conceptualize what are we going to act on. Put in a program. So these are our program. We designed a global health and wellness strategy that takes a holistic approach to support employee well-being. Number 1 is we need to tackle the mind, educate people to why, what can we do. Now we need to tackle the body. So we need to put in physical activities that would create this avenue for people for our employees to join in. Now we're also talking about financial wellness. We introduce why is it important to save? Why is it important to invest? What will happen if you don't? My dream for me and my wife is that when we go to our senior years is that we can still sustain the lifestyle that we have and at least be able to buy the basic commodities without asking for help. I think if not all, most of us would love to have that, right? So financial awareness is something that has been, I would say, taboo before, like 10 years ago. But I'm really glad that a lot of companies right now are talking about financial awareness with our employees. So now we identified the pillars. Here are the actions. Stress-free me and stress management activities. We also have the sleep education and awareness, meditation and yoga. I like this one. I think this is my favorite among this on mine, which is the emergency preparedness. It's not news to us that a couple or 5 years ago, we've experienced the typhoons here in the Philippines. They're tremendous, right? And I'm sure most of you will agree that we could have saved more lives if we were prepared when that calamity came in. And the emergency preparedness is a seminar for our employees to say, these are the things that you should be ready for. For example, a medical kit, radio batteries, where do you go in case of emergency? So that prepares you to the worst case scenario. So knock on wood, if that happens, you'll be mentally prepared and be able to think of survival and not worry about cramming or panicking during the time of calamity. Now, I'll move on to the next pillar, which is body. We partner with different gym companies in the Philippines. I could say them, right? Gold's Gym and Anytime Fitness. These are expensive gyms, right? And I'm glad to say that we were able to manage and negotiate a good price for our employees so that, they will be able to enjoy going to a nice gym, free from, free from dirt or compared to the gyms that we're used to see in our village or the small towns. They're world class. So we want our employees to also experience that. Now, I'll move on. Our part of the bodies will be smoking cessation. And it prepares you. First is why? What are sickness that you can get out of smoking cessation? And there is also counseling. If it's hard, there's also counseling, which I will talk to you more about in the next slides. Now, we also talked about finance. In financial wellness, small things come a long way. And bullet number 2, you will see there, company perks. All of these things are included in our employee value proposition. And the company perks, we tie up with different companies. Grab, so that we can get discounts for our employees. Gardenia, so we can get discounts for basic commodities and Unilever. So these are just some of the companies that we are partnering with, so that these small things, when put together in a month, the employees will see the savings that they have and probably invest that to somewhere like stocks, or just save it, or put it somewhere that the money will grow. So that's really important, and we have introduced that thought to our employees. Now, we also created avenues, like we invited banks, we invited different insurance companies to come to us and conduct financial awareness so that we would know, because 5 or 10 years ago, I didn't really know about more of stocks. And because of these programs, I get to know what stocks, at least for on a basic perspective. And that's coming from a Filipino who really, when we were younger, there were no financial subjects in terms of discussing directly stocks into the school. But I'm so glad that a lot of personalities are now discussing stocks and financial awareness into different companies now. So it was not easy, program evolution. So Richard mentioned we started about 2002, 2005 here in the Philippines. And from the basic card, just what the government is mandating, we developed a program. And, it was a trial and error stage. So we conceptualized in 2012, rolled it out in 2013, and it's only in 2015 that we saw a lot of interest from our folks and seeing that, hey, people are joining it. Wow. In 2016, we've had dedicated people, who are joining the wellness champions. In each sites, 20 sites in the Philippines, you'd see an example, or people who are showing that it can be done. Because sometimes it's different when you see, okay, I'm going to listen to this seminar, and when I know it, okay, I'll try it again tomorrow. And then after tomorrow, after a week, you tend to forget it. But if you have somebody who's becoming an example of it, like weight loss program, smoking cessation, it just says that, hey, it can be done, right? And let me take you to our journey, specifically on what we were adding year over year. 2012, we have the HMO plan and life insurance. In 2013, we were able to launch our employee assistance program. This is the counseling program that we have for employees, and I have a specific slide for that for you. In 2014, we were able to determine the need for hypertension and asthma and disease management. 2015, we were able to put in wellness incentive plans. If you join an activity, you will get extra money. And this need to be consistent. Quarterly, you need to join an activity so that you can earn extra money. So what's in it for the employee? Okay, because the interest is not yet there. really hitting it on the ground. You need to entice them first. And when they see the effect on why it is working, or what is working, then, and if you continue to put in those incentives, then you will continue to gather more participation from your folks. And then we had the voluntary dependent plan for parents over age. Usually there is a cap limit for age, right? 60 years old. And for siblings, it's about 21 years old. And us, being a Filipino, we care so much for our family. Even to the point that even if we have our own families, we want to continue to take care of our parents. And at some point, our siblings, even if they are over age already. I mean for the siblings, but most especially for the parents, if they're over age above 60 senior years, we need to continue to care for them, right? That's innate with us Filipinos. And we took that criteria off our HMO coverage and made sure that we are catering to the needs of our employees. Now, in 2016, we removed that hierarchy of who you can enroll first. If you want to enroll your siblings first and then your mother, if you're in a budget, at least we are giving you an option to do that. Because there's a certain contribution between the company and the employee. So you can prioritize on which one. You'll have an option to do which one you would like to take care first. And then lastly, on 2017, this year, we're proud to announce that we were able to, earlier I heard this already, but domestic partnership coverage. This includes the LGBTQ community. And if you are able to establish that partnership within your community, you get like a barangay clearance, a small community clearance saying that, hey, we have been living together, something like that. Present that, and then your partner will be eligible for our HMO dependent. So we can do that. We've just introduced that this year. We will continue to have our pregnancy program, enhance our smoking cessation program, and we also partnered with Sabrinas Kitchen so that we can create this avenue. So you're doing gym already, but from my experience, it was 30% of the work. Eating clean is something that is hard and is a work in progress. But if you provide that avenue and what really is available out there, then our employees will have some options and they will be able to decide which one to take. So with Sabrina's Kitchen, they were able to help us, teach our employees how to cook, healthy food. So I talked about our employee assistance program, and we're proud of this because this does not just cover our employees, but also their immediate family. And what this does is this a counseling hotline. So you would see, like, do you have problems? I dealt with diet for about 1 week, and I'm having a hard time doing it. So there's a number that you could call. Say, we partnered with a third-party company in the Philippines that specializes with different aspects like health and wellness, financial, legal advice, and relationships. And this is available for our employees so they can seek, consult, and get that resource or support that would take them, or self-help that would take them to the next level in overcoming hardships and on the steps on health and wellness that they're experiencing. So this is an in-person and unlimited telephonic counseling. We do coaching and training for managers, and all the other things include health and wellness lectures and seminars and educational materials. So key is, we're not just covering out for our employees, we're covering also for the immediate family members of our employees, because we believe that the less stress that the employee has in thinking about their loved ones, with their families, the better that they will be able to come in without any worries and work, and the better that they will be able to go through the day without any stress. Communication is the key, right? Wanting to put in a program, another thing is to do follow-ups for the programs that you have initiated. So we partner with leadership in operations and human capital. Just to give you an example, so for example, if a team talks about schedules on when are you going to pull out people for health and wellness, and it's not the right schedule, like 2 a.m. in the morning for BPOs or 3 a.m. in the morning, and then that's like the peak hour of our operations. Is it the right time to pull out or no? And then after every session, was it beneficial for the agents or no? Or for our employees or no? So feedback is very important after each program that we're doing, and the leadership team of TeleTech is committed on getting this feedback and making sure that it reaches out the team who's involved in creating wellness programs, which by the way they are here today, and help them out, help us be better in the next time that we're going to create a new wellness program. We are also doing the digital presence in social media. So we mentioned earlier, not everybody can attend the wellness programs, like 10%, 20% of your workforce. 40% really is a really great number. So if we can get 40% of your employees attend the wellness program, that's really great. If we can increase that, that's really great. However, for those who were able to attend it or not able to attend it, then the thing is, you have available resources online which they can pick up on their own time and read about. So this is still available, and we will continue to put that out there and promote it to our employees so that when they have their free time, they can just pull it out. So we have our own social media. We also have our own network for providing feedback and getting this information through the intranet of TeleTech. We also have our own website for health and wellness for TeleTech, which they can download all these information. Now, how serious are we in doing this? We have a dedicated team of working for our health and wellness champions. One of them is here, Sheena Grace Atienza. Thank you very much for helping me with this. And she's really one of the brainchilds, really smart girl. And with all of the programs that we're having for TeleTech, she's making sure that all of these things are successful. And if there's an area for opportunity, we brainstorm, discuss, what can we do better next time? And in all of the sites of TeleTech, we have 80 wellness champions that set an example for other employees, and we get them, and we are able to talk to them with a regular talks to them and make sure that we stay relevant to what they need. Let me show you some pictures that we have for Family Fun Run. Their family members are included, and this is a very festive event. And we have raffle prizes, we have seminars in doing this, and what's the proper way to run, basically all the education that goes behind running. We also have the on-site fitness classes. We do gym inside the office, but at the same time, we also have wellness classes on the gyms that partnered with us. And this is Sabrinas Kitchen. In their 7th season, Sabrina went to our offices and basically did a cooking demo show. So that educated more of our employees on how to do health and wellness in terms of cooking. So what are we expecting for 2018? We will continue with the Great Expectations of Healthy Pregnancy program. We also found out about the pre-diabetes concern, so we would like to prevent it. And then we have the smoking cessation program. We partnered with Shell Foundation for HIV and AIDS awareness. Our leaders, including myself, are getting ourselves tested every year. And we're continuing to look on the sleep program and vision program. And we are, because Richard, the HIE CEO Awards has raised the bar higher for wellness program, and we are really appreciative of it. Next year, we'll do our best to be able to top what we have done for 2017 and continue to do this not just for the awards, but really for the employees. Really, we want to show them that we care. We want to continue that we want to prevent these sicknesses that are happening. So, with that thing in mind, I would like to end with this. Our goal really is to do preventive. We want to see less and less of this sickness coming experienced by our employees. Diabetes, hypertension, and all the other sickness that are associated, smoking, cessation, and all of the things that came up from our HMO plan. And Experience TeleTech, there's a hashtag Experience TeleTech that you can search in our Facebook page, in Facebook. And you will see how people are living life passionately. And if you are sick, if you are sick and broke and not able to do the things that you're supposed to do, including taking care of your family, including taking care of your loved ones, and doing all these things for them, then how could it be, or how will we be able to live life passionately when you are like that, or when we have sickness? So, with that in mind, we would like to thank you for listening to our story, and cheers to you guys. Thank you.